Good morning.
Good morning. How are you?
Well, thank you. Thank you.
Good. I'm so glad that we are able to have you on our segment, and we're going to title this Mental Health with Dr. Tika, right?
Yes, Mental Health Minute with Dr. Tika.
Mental Health Minute with Dr. Tika. Okay. All right. So we have here with us on Bottom Line with Ron and Byron, Dr. Latika Highsmith, and she just opened up a practice here in Marianna. So welcome to the show, Dr. Tika.
Thank you. Thank you. Thank you. Yes, I opened up February the 28th was our grand opening. Thank you for showing up. I really appreciate the community support, and I thank you from the bottom of my heart. I was born and raised in Marianna, so it's an honor to give back to the community, that I was reared, so I love it.
Good, good. So let's just dive right in. Tell us the services that you're offering.
So I start from family. So that's whole life from 4 to 99 is my age range. So it's whole life. And I service ADHD, bipolar, schizophrenia, medication management, counseling services, marriage counseling, and also tutoring for children who are behind academically.
Okay. And when you say tutoring, are you saying elementary, high school, combination?
Elementary, high school, K through 12.
Okay. So do you have like a particular area that you kind of zone in on?
Mm-hmm. Well, my favorite is young children and the elderly. That's I specialize in. Adults, I take care of a lot of adults, but it's very interesting, young and the very old. And, somewhere in the middle is, most adults, we're so busy. And finding the time to just stay mentally healthy and mentally fit with job, work, taking care of aging parents. Sometimes it's a bit challenging. So that's one of the reasons why I really want to, make mental health awareness, for all walks of life, whatever stage or cycle we're in, to just really state the importance of being mentally fit at every walk and every stage of life.
It's so good you mentioned that, because here, just in Jackson County, we see so many people that are having mental health challenges. And it seemed like the resources are limited. So with you opening up here, that just gives us more resources here to, help the people in the community.
Yes, that's exactly. And that's my mission, to do God's will and also to help the community and kind of get that work-life balance and, and going through the different challenges that we're all experiencing globally. Mental health is not just a small town issue, it's a global issue. And I just thank God for the opportunity to really help with this ongoing need.
So now this is your second practice. So your first practice is in Richmond, Texas. Mm-hmm. So tell us how you're going to balance both offices.
Well, yeah. So everything right now is mostly virtual. Even in my practice in Richmond, I do usually see people once a month, face to face, to kind of just have that, that feel that we have coffee time and tea time, and we just have a lot of good times here. And so a lot of people need that connection, that physical connection. And so once a month, I'll schedule everybody, on my team, and we'll come in and we'll have that face to face. And so that's the plan that I would probably do for Marianna as well. I'll do sessions, telehealth, like we're doing Zoom conferences, but once a month we'll have a face-to-face encounter.
Okay. And so your staff in Marianna, what do they consist of? Like, what professionals do they consist of?
My niche in Marianna is substance abuse. As we know, the substance abuse has been an ongoing issue in Marianna, especially in the African American population. And, I just really, really, really want to give back and offering affordable, treatment and kind of being the gateway between Panama City, Marianna, and Tallahassee to have some type of crisis and intervention team to back us up when, you know, you have this kid or you have this adult who's freaking out on you. You know, what do I do? You know, sometimes in most cases, people call the police, and the police are good for doing police work, but not for mental health. And even if they calm down just a little bit when they see the police come, you're still stuck with that crisis on your hand because we don't know where to go, where to, you know, where to send our loved ones. So it's my goal to be that kind of mediator between the hospital, the police, and, you know, really sending the patient where they really need to go, as far as, do they need to be hospitalized right now, or is this something that I can maintain, you know, with the session, you know, one-on-one. So that's my ultimate goal.
So Dr. Tika, what we see here in Jackson County on an ongoing basis, what happens is someone, you know, a loved one, you know, has some issues, they're acting out, and then they get Baker acted. And so they get sent to Bay Behavioral or Life Management in Panama City. And they're there for like maybe 3 days, and then they're back home. And it's almost like a revolving cycle. So nobody seems to have the answer on what to do, you know, how to help and how to get the loved one the actual, you know, assistance that they really need.
And that you're exactly right. And one of the problems we have with that is, once they get home, well, what do you do with them? If they're not taking their medication, and if they're not going to pick up those medications and following the prescription in the right times and the right dosage and all of that, that will be a recycling door. So that's part of one of the benefits of having me in Marianna. I'll also have the person will have a case manager assigned. And so when we have a crisis going on, I'll send an assessment team to your home to ensure that their medication is being delivered properly, the prescription was picked up, and we can kind of intersect and decrease hospitalization and maintain stabilization at home. And doing a whole lot of therapy, group therapy, and getting down to the root cause analysis. So why am I using? Because that really should be the ultimate question. Why am I behaving the way, you know, that I am? And, you know, if it is drugs, well, when did it start? And what do I do now? Because using drugs is really not the issue. Sobriety is the issue, maintaining sobriety. And a lot of people are afraid of that, you know, staying clean. And so that's my goal is, you know, having sobriety and understanding, you know, what staying clean is about and why, and what is it worth, you know, for you, your family, your children, and stopping, you know, this whole cycle of generational curses, you know, of this drug addiction and drug abuse, and just, you know, my prayer is just to get stabilization in the community all around, from home, work, the whole facet, just a whole facet.
So I want to switch to another area, population here that we have, and that's population of people that have beginning stages of dementia. And so they exhibit the same types of behavioral issues, and they get Baker acted, and you know, same cycle. And so how do you differentiate, and are you able to treat those patients as well?
Oh yeah. Okay. And I take care of 2 nursing homes and 2 assisted livings. And again, that's my specialty, and my niche is dementia with behavioral disturbances. So that's the thing that we have. And often with dementia, with behavioral disturbances, with the elderly, and another thing that I bring, facet that I bring to the table, is that I'm board certified in mental health and also family. I'm also a family psychiatric nurse practitioner as well, and also a family nurse practitioner as well. So I go over the medical side as well as the mental side. So a lot of times with the elderly, we have to make sure that it's not an underlying problem like a urinary tract infection, blood pressure is out of whack. So I rule out to make sure it's not a medical condition first, and then I get into the mental health deal. And that's the same thing with the mental health on anybody at any age. First, I rule out to make sure your thyroid is functioning properly. I make sure that your diabetes is in check, because if diabetes is too high, we have an irritable mood, we have irregular with blood sugar's bouncing all over the place. And so you'll exhibit that, stress and decisions, that you make in your daily lives. You're not able to do that, correctly or, rationally. So going back to the dementia clients, I rule out to ensure that it's not a medical condition. And once I've stabilized that and know that it's not a medical condition, then there's tons and tons of things that we can do to stabilize those type of behaviors. But 9 times out of 10, with the elderly, it's probably an underlying condition, such as,
that's interesting that you brought that up, because I think those go unnoticed or untreated, and then that's why they never get to the bottom line of the problem.
Mm-hmm.
So let's talk about your staff and your team. Tell me, the licensed professionals that are part of your team that will be accessible here in Marianna.
Mm-hmm. So registered nurses will be on staff like now from 9 to 5, Monday through Friday. Licensed chemical substance abuse counselor. And again, this will all start May the 1st. And we're going to have a case manager, again, a case management team to actually go out and assist and to make sure that we have a collaborative approach all the way around from home, doctors, primary care doctors, and also your mental health care provider. So it's all collaborative approach to hope that we can all reach the same goal, whole life and safe.
So you said May 1st, that's when.
Mm-hmm.
Okay. So what starts April 1st? You had mentioned that during your grand opening.
April 31st.
April 31st. Okay, I got you. Okay.
Yeah.
So everything starts April 31st, May 1st, as far as receiving clients. Now, can someone call like now and kind of get an overview or get an appointment? Absolutely. Okay. So tell us, how does that work? So let's give you a case scenario. Okay. It's March 7th right now. Loved one just got, Baker acted. They spent, 3 or 4 days in Panama City at Life Management Center, and now they're back home. They are following up, but still something seems off. What do we do?
Okay. Well, first off, we have to figure out, well, what does the patient have? So first of all, I accept right now all commercial insurances, and also if for the non-insured, I also will accept a payment plan. Okay. So a lot of times with mental health, most people don't have any way of payment. Okay, especially with the drug addiction. Medicaid and Medicare, that's a process. So, the licensure process is still being worked on. So, but commercial insurances and payment plans are readily available like right now. But you would do an intake packet. Okay, you would reach out to the office staff in Marianna, and they would give you our website. And it'll tell you to go what it would expect on my first visit. And on our first visit, you'll have an intake package. So it has adult or child. And you would simply download that packet, print it off, and bring it over to the office in Marianna, your driver's license and your insurance card. And then we'll take it and we'll process the rest from there.
Okay. All right. So step 1, reach out to your office, get an intake pack, and they can pick it up from the office, and give us that address again in Marianna.
4469 Suite A, Clinton Street, Marianna, Florida, 32446.
And for those who don't know, that building used to be the Department of Children and Family building. So that's, if you're trying to pinpoint where this is, that's the building. That's where Dr. Tika and her staff are located. So step 1, you're going to call the office and give us that number. 832-847-4836 is the Texas location, and the Texas location is the mother hub. So you'll call here first, and then we'll direct the traffic to wherever you need to go. Great. So you're gonna call the number. You're gonna get the intake package, and then from there they're gonna direct you on how to get the proper care and treatment for your loved one. Now, I have one more question for you. I want to ask regarding services. We have a lot of autistic, patients and adults here. So is that something on your scope or not?
Yes, I believe in being
Okay.
multifaceted. I'm actually certified in autism, ADHD, dementia,
Okay.
and Alzheimer's. So once again, I'm from, I was raised by my grandparents. And so I've always been in the company of the elderly. So my grandmother worked for years at Sunland. She retired at Sunland, and she would often bring home the clients with her, for the weekend. So, when I tell you God, he says such a time as this, and he like prepared, the way didn't have a clue why or what all of this was for, my struggles, my life, my story, whatever, but it's for now, it's for such a time as this. So yes, ma'am. I do take care of autistic kids, elderly, um, ADHD, Alzheimer's, dementia, what else? Down syndrome is a big one that we service here at Osana, and from birth to life.
Awesome. 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 Well, I definitely am going to help you get the word out, because that's a whole nother population of adults with autism. And I'm going to be honest with you, what happens is once they graduate from Hope School, and I have a brother who's 22, I think now, graduated from Hope School about 2 years ago. And so right now, there's nothing. He's not doing anything, honestly.
Yeah.
But so I'd love to get an appointment, and so you can kind of figure out what can help him, kind of get more self-independent. So let's talk about your credentials, because everybody will say, well, what is she, who is she? We kind of hit on some, but just spell it out. What do you do? What do you have?
And I want to hit on one little note to one thing that I think is very important for us to mention, is that rehabilitation for the prison system.
Oh,
people who are coming out of prison, how to get them, back into the mainstream of, society, so we don't have any repeated offenders, especially with substance abuse. Okay. So that's a real hot on my agenda of getting, the community awareness and giving prison, coming out of prison a second chance, and also getting them mentally fit to contribute back to the community. Okay.
Awesome. That's awesome. That's really needed. I know there's a research I think it's called release coordinator over at one of the prisons. So we definitely have to connect you guys.
Oh yeah.
Yeah.
For sure. Now, I am a board certified family psychiatric nurse practitioner with a doctorate degree. And I have a master's degree in family nurse practitioner. I have been practicing nursing probably about 23 years now. I have been in practice in the state of Texas for 5 years. And I have, again, a wonderful staff here. My office manager, her name is Stevie. Stevie, come say hi. Oh.
Yes, say hi.
And you'll see her a lot. This is my right hand here.
Hi, Stevie. Nice to meet you.
You too.
And then we have Christine. I have to make sure we get Christine on our next go around. And Christine, she's actually she works in Philippines, and we've been together for now almost a year. She helps with our direction of like getting reports together and all of that kind of stuff ready for whoever needs it, primary care physicians, the VA. I'm connected with the VA here in Houston. So I take care of quite a bit of veterans as well. So yeah, so we're just Osana, we're just round and about to really just implement and really be a great resource for the community.
This is awesome. So, you cover, entire spectrum, what it seems like, of mental health, so which is very much needed. So tell us the name Osana.
Osana.
Tell us about that name.
Well, I had to make sure that it was meaningful and represent who I am, right? And, in the word of God, names mean something, right? And I was in when I was looking and searching, I was like, I have to come up with something meaningful that represents me and where I'm at in my walk in my life. And Osana says that God saves us.
Wow.
That's in Hebrew, but in Spanish, it means health. Okay. So take whatever you need. So health, or either if you're looking for the Lord to save you.
Wow, that's awesome. That is awesome.
Mhm.
Wow, that's awesome. I was wondering, how that name came about. So that is, it's
Mhm.
so fitting for what you're doing.
Mhm.
And we're so happy to have you here, Mariana. And, we're delighted to help you get, the word out into the community so our community can get the resources and the assistance that's much needed. So
Oh, yeah.
again, Dr. Tika, tell us again your address, your phone number again before we wrap it up, okay?
Let me give you that Mariana number so I can be real clear on that.
Okay.
Let's see. Stevie, do you happen to have the Mariana number on hand?
And remember, guys, she's located in what used to be the Department of Family and Children Services building on Clinton Street. So that's the location, and she's going to give you the phone number to Mariana.
So Mariana location is, telephone number is 850-394-4930. 850-394-4930. Address is 4469 Clinton Street, Suite A, Mariana, Florida, 32446. And I can't wait to have just give me a call. I'm a very personable person. A lot of things that my clients here in Texas, they're like, 5 minutes, Dr. Tika. I say 5 minutes, and you have me after 7:30, I go to bed. So a few minutes we can talk and just kind of catch up, and I'll give you the little 5 minutes and kind of get you motivated and get back on the right track.
Awesome.
So, yeah.
Awesome. Well, we are again, thank you so much for, bringing it back to our community here in Jackson County, and anything we can do for you. And bottom line with Ron and Byron, please let us know. Is there anything that I missed and that you want to share?
No, and thank you so much for doing what you do. And I appreciate you embracing Osana, and we are eternally grateful. And I know God is going to do great and mighty things for your practice when you start out, because that's what it takes. You got to give to get, and keep giving. And you're doing an awesome job for the community. So it's a pleasure to meet you.
Thank you. So we'll have to catch you again when you're back in Florida. But for now, we'll wrap it up. And we just had a mental health minute with Dr. Tika. Thank you.
Bye-bye.
Bye-bye.